टेलीफोन डे। अब एक जमाने में एक टेलीफोन रहा करता था, पूरा मोहल्ला यूज करता था, और जिसका वो टेलीफोन हुआ करता था उसका, क्या कहते हैं, प्राइवेसी नाम की कोई चीज नहीं रहती थी। यहाँ से फोन आया, साहब उनको बुला दो, वहां से फोन आ गए, इमरजेंसी है। तो फोन एक बड़ी नायाब चीज हुआ करता था। आज मैंने फ्लायर में दिया है, किस बड़े डिब्बे से लेके वो कहाँ मोबाइल तक आ गए, फ्लिप और फोल्ड तक हम आ चुके हैं, और वॉच तक आ चुके हैं, क्लॉक तक आ चुके हैं। कहाँ फोन नहीं है। तो आज फोन का बड़ा उपयोग, अच्छा उपयोग, जितना गलत उपयोग होता होगा, उससे कुछ ना कुछ ज्ञानवर्धन में उपयोग जरूर हो रहा है। मैं आज के वक्ताओं डॉक्टर शैकत कुमार बसु जी का हार्दिक स्वागत करता हूं, डॉक्टर सुपर्णा जी का हार्दिक स्वागत करता हूं, और आज टेलीफोन डे की बधाइयां देता हूं कि चलिए किसी ने सोचा तो सही, टेलीफोन बना तो आज हम फ्लिप फोन पे आ पाए हैं। बहुत बहुत आभार आप सभी का। इंटरनेशनल वेबिनार 2331 में आपका हार्दिक स्वागत, बहुत बहुत स्वागत। मैं डॉक्टर सुपर्णा सान्याल मुखर्जी मैडम को सादर आमंत्रित करता हूं उनके आशीर्वचनों के लिए। आई वुड लाइक टू वेलकम डॉक्टर सुपर्णा सान्याल मुखर्जी मैडम। वेलकम।
शर्मा जी, इन बिटवीन ये
Thank you very
सैकत
much.
वासु, मैं
है।
कल आ जाऊंगा। सैकत
थैंक यू,
वासु बोल रहा हूँ। आई विल बी कमिंग टुमारो। ओके,
थैंक यू, थैंक
कंफर्म्ड। थैंक यू।
Okay, but I would not come. So मेरा जो भी है आप शेखर जी को दे दीजिए. So he will receive on behalf of me. Thank you very much. Thanks for giving me such an opportunity in this AYUSH SAMRIDDHI platform. I am really elated for your this recognition, along with the opportunity you have provided me for this long time process and long journey. So this is the AYUSH SAMRIDDHI, which is the best portfolio and the best platform for the all types of Ayush related, along with uh, the present juncture and telephone, the World Telephone Day. The telephone is a very good communication. It hence it is. It has been studied and it has been observed that in services and the Ayush message. So telephone has support so many system orientation. Before there is a drastic change which has been happened, because previously the earlier stage when the first telephone was invented, that time the size of telephone, the uses of telephone was quite different than which we are using now. So every day, every time, the evolution of telephone has happened. There is a big model was there. There is a big system was there. There is a wire was there. So there is no one who can be provide telephone. It has not been possible by everyone who can avail the telephone, because the cost effectiveness was there, and those who are the higher strata of the society and the economic stability, they can only provide. But there is a system who can help to the each other. So afterwards, if we have seen the after independence, we have seen the development of the telephone. So we can, there are few houses and there are few households they can use the telephone. Then when we have come across the 2020, then 2000, the era of 2000, when the millennium we have touched, we have pointed out the new formation of the telephone. But recent era has been evolved and invented several types of telephonic, messages, several types of telephone, the structure, then the mobile phone, then land phone, then tablet, then other probabilities, possibilities. So many things are there. The telephone is reached to the now at this present juncture in this present era. So wow, this telephone is useful for the health benefit because the community health system is very good for through this telephone. So nowadays, what has been happening? The workers, the community health workers, are the core component of the public health facilities and the healthcare facilities. Evidence suggests that the services offered by these workers have helped in the decline of maternal and child morbidity and mortality rates and burden of communicable and non-communicable
Your
diseases.
voice is interrupted,
Second,
madam.
uh, this telephone, now is it
Your voice is
all
not
right?
coming, madam.
If I'll open my video, then only the voice will be disrupted. That's why I have closed my video. So I'm closing the video and then I hope it will be audible now. So telephone, the public system, the public-private system and the public orientation and the communicable and non-communicable diseases has been covered by this, the telephone, telemedicine. And the goal of SDG, the Sustainable Development Goal, is also targets in every situation, every life sustainability, where we can get and where we can emphasize on this telephonic method. The recent concerns and the consensing and concern this current pace and progress where we can emphasizing the telephonic message and telephonic health system. This telephonic health system is giving you the financial sustainability. This telephonic telemedicine will provide you the quick action. This telephonic message will give you the health system, like those who are suffering in the remote sensing places. If there is no kind of medicines, the telemedicines can provide. And there are so many apps are there like Shasta Sundar telemedicines. And so if you are not providing getting medicines, the if you can introduce and if you can input your queries and your requirement, the person should reach to the remote sensing places and you will get your medicines through the telephonic messages. And in these cases, like the improvement of the productivity, some incorporation and the medicinal aspect which can help you, that there are several the companies, those companies are producing that there are so many the lab system, which lab systems providing you different types of medicines and different for the different diseases, which is not possible. They can, like the rural Bengal or rural India, where the people are not getting the proper testing factors, the medicines, the community health system will provide the good medicines. At the same time, the mobile medical unit, this mobile medical unit is possible through this the telephonic messages and telephonic discussions and the monitoring process by this telephone. And so you can say that the future research effort and policy dialogues should be the directed, and it should be the incorporated the health policies by which we can emphasize on this telephonic message and telephonic discussions and the monitoring process by this telephone. And so you can say that the future research effort and policy dialogues should be the
Hari Om. हरि ओम। आज आपकी आवाज डिस्टर्ब कर रही है मैडम, कट रही है। शकत जी, डॉक्टर
हाँ
शकत
जी।
बोल, प्लीज
दो
सर।
मिनट थोड़ा देख लेते हैं कि उसका कम्युनिकेशन थोड़ा प्रॉब्लम हो रहा है क्या। एनीवेज, क्या मैं स्टार्ट कर दूं?
सुपर्णा जी, आप तक में हमारी आवाज जा रही है क्या? नहीं, ऑडियो नहीं जुड़ा उनका। हाँ, यू कैन।
एक मिनट, मे बी आई विल कॉल एंड चेक इट वन मोर टाइम। या
सुपर्णा जी प्रणाम। Kindly continue.
So that's why the telemedicine is very important aspects nowadays, where we can sustain and sustainable development goal, also emphasizing through this telemedicine, and doctors are attending through the internet system, which we can provide the internet possibilities and probabilities, and healthcare benefit is also emphasizing by this telemedicine system. And moreover, there are so many specialized doctors in each and every hospitals, then the healthcare patterns which can emphasize the telemedicine and the telephonic discussion with the doctors. If we cannot go to the doctor's chamber, if there is the cost effectiveness, because the people, those who are not reaching to the hospital very recently, they can take the primary health system. That means they can take the suggestions from the doctor what they have to do. So the first effect, or the first aid they can do it, patient, then only they can transfer to the hospital. So this is the also the burden of the hospital can be restored to the medicinal aspect and telemedicinal aspect, which can restore the doctors and doctors advice along with, and prevention is very important over here. So if we can get the proper idea, at the same time the suggestions from the doctor and the awareness of of any kinds of medicine, then only we can get the better environment, the better placement, and at the same time the better medicinal aspect and guidance from the doctor. So it is very important nowadays in case of the Ayush, allopathic, homeopathic, every parts of the world, it is very important for us. Thank you very much. Thanks for giving me such an opportunity. Thanks a lot.
Thank you, madam. Thank you very much. Now I would like to invite Dr. Sakat Kumar Basuji. Sakat.
Thank you. Thank you, Sharmaji. Thank you very much for inviting me to this platform. It's an very important day of the World Telephone Day, which is being celebrated with pomp, and grandeur. Thomas Alva Edison once started this revolution that has changed and transformed communication around the world. Today, we are able to reach from across any continent to the other continent, not just from one place to another, to reach with one and communicate, exchange information. And with the evolution of smartphone, now the whole world is in your hand, right at this time. If I wish, I can connect to any part of the world. There are so many chats through the internet. The information technology pathway has changed and transformed drastically, in the sense that it has reached every corner of the planet, even in remote rural areas or border areas where there are towers. We are being now teleconnected. By tele, this prefix means from a distance. So telecommunication has evolved over the time, and from the days of the ringing phone to our highly developed iPhones, today we are on a telecommunication revolution. Everywhere the internet can be now that today we could communicate with the blink of an eye from one place to another and connect with one another in an instance. And there is so much, our phone has transformed into a mobile office. We are using our telephone to do a lot of our mobile work, in the sense that I can travel by plane, I can travel by train, I can travel by car, and I can still continue and do my office work. And I do not need to carry any heavy or very complicated or instruments with me to keep my communication. I can reach from an instant from one corner of the world to the other. This has changed the pattern of business communications this has impacted our research and development. This has changed our social communication, that we have lost the habit of writing letters. How many of us, other than doing emails or WhatsApp chats or mixes, we take the opportunity to write letters? Unless it's something that an official application or a government letter, or something that we need to send through post because of some official obligation, the exchange of letters have transformed. We are more connected to one another through our phone, and now you can even see to one another, to a distant relative, through WhatsApp and other available um, chat boxes through which we can communicate with one another. So this information technology revolution, integrated with the telecommunication revolution, has changed and transformed our world in a very new way. It has resulted in many positive aspects, like changing our business pattern, changing our communication pattern, integrating one continent with the other. If, even if you are located in the distant, remote part of the world, you can reach out to your loved ones with very simple phones or the smartphones that we have. We can do so much of our complicated office related works, developing letters, doing our business books, account books, everything, financial transactions, important communication, storage of data, taking pictures and storing them for documentation purpose, as well as for just for sociological contact. It has become so easy. Since this new mode of telecommunication information technology pathway of revolution has transformed our life, it has also transformed our healthcare. There used to be a time when you have to send someone to the doctor to provide a call to get them there. Today we are talking about telemedicine. Telemedicine that is applicable in case of allopathic medication, which is now becoming extremely popular, where doctors from the district quarters or the district headquarters or from the capitals could cater to a wide range of patients sitting at various hospitals and stuff, and communicating with the doctor, prescribing them with information. If you are a member of many medical WhatsApp group, and if you are provided with a number from your hospital, if you communicate with the hospital with your number, then your doctors are able to access you and they can connect and communicate with you. If you are having in Western countries, special kinds of ring bells are associated with the body in the form of rings, or it's hanging as pendants from your neck, and you just need to press that button and telecommunication message will reach the hospital that you are in an emergency, and the ambulance will come to you. Because sometimes when you are sick, you are by yourself, there is very little opportunity for you to even call an emergency number or a healthcare facility to communicate with one another. Then this telecommunication, the telephone, could work. The small chips of telephone are now being placed on this pendant ring so that you can connect with your hospital, and if there is an emergency, they could come and take care. Even in India, advanced senior citizen care, where you are not living in a senior citizen home, you are living in your own home, but you are all by yourself, then the senior citizen caring centers are connected with you through such telecommunication chip or telechips, where you can press and connect them if you are under emergency. And these people have keys to your house under special protection acts and stuff, communication and dealings with them. They can immediately come to your place, call ambulance, take you to the hospital for your treatments and stuff, and take care of you. All these challenges or all these opportunities in positive terms have helped our healthcare in an indiscriminate way to flourish across the continent, even in India or even in smaller, poorer countries of Africa, Latin America, or Asia. People are able to connect to the doctors very significantly through our telecommunication network, through our information technology network, through internet, through our WhatsApp chats and stuff. Everywhere you are able to connect to the healthcare system. And how this can apply to Ayush? The same system, I think, is also working in various Ayush hospitals and stuff, where the communication with the patients are being intermitted and integrated with our internet network, so that in the same way that you can communicate with your allopath doctor, in the same way you can also communicate with your Ayurvedic doctor. The biggest telemedicine with respect to Ayush has already a revolution taken place during the COVID, when even in distant Western countries or Middle East, any individual who was suffering from any kind of COVID related symptoms or similar to COVID symptoms, they have communicated to the doctors in India, the Ayush doctors or the Ayurvedic practitioners, for, for formulation, for prescriptions, for drug formulation ideas, what they can do at home. All this has helped extensively, and a telemedicine revolution with respect to Ayush has already taken place during the COVID, where people were helpless and they were reaching out to doctors of Ayush background in India for help and support from the entire world. And these needs to continue even to this date. Just like allopathic doctors, as our systems are changing, it is important that our Ayush doctors too take advantage of our telecommunication and information technology system and get integrated with such networks. Whether a patient is unable to reach you, could sit in a center and through telecommunication can reach you for consultation. And the payments could easily be done through so many of the electronic transaction payments that we have, such as Chai Pay, UPI, and various other sources that the patient can pay back the doctor. And at the same time, the doctor, even being in another city or another town or even in another country or another continent, can reach his patient easily through such communication channels. And if he or she is suffering from any kinds of illness or ailments, then a prescription could be provided. You can provide your prescription through WhatsApp. You can provide your prescription through MSN messages. So many Snapchat, WinChat, so many other apps have become now available. There are so many medical apps which are now being made available, where the interface between the doctor, the physician, which could be Ayush, which could be our allopathic doctors, and the patient, has been integrating and improving massively. Just like our Google links that we use, or other available WebEx and other links that we use for our communication and meeting, such apps are getting increasingly available and is revolutionizing the medical fraternity, both in terms of allopath, homeopath, and Ayush, in all direction, in all possible way. So I think this is going to flourish more in the coming days. And in the World Telephone Day, it is very important to suggest that Ayush has transformed and become a winner in this part and is going to continue and sustain in the long run. Thank you very much for providing me this opportunity. It has been a pleasure. Thank you, Dr. Sharma.
वेरी मच, थैंक यू वेरी मच। मैं आदरणीय लक्ष्मीकांत द्विवेदी सर से उनके फोन की यादें सुनना चाहता हूँ, क्योंकि फोन पहले खुद ही एकमात्र याद था। आदरणीय गुरुदेव यदि कंफर्टेबल हैं तो।
नमस्कार। विद्वान
नमस्कार।
वक्ताओं ने काफी अच्छा स्वरूप में प्रस्तुत किया। और जहाँ तक मेरी यादों की बात है, तो बचपन में कभी जरूरत पड़ती तो जैसा पवन जी ने बताया वैसे ही जाकर के, और कई बार दुकानों पे जाकर के 1 रुपया दे करके बात करते थे। वो पेमेंट भी क्योंकि पड़ोस में है, और वो कई बार होता है कि साहब नहीं है, और कभी जाएं तो मना कर दे, वो भी अच्छा नहीं, तो चलो किसी शॉप पे चले जाते हैं। तो काफी मतलब ज्यादा बात करते तो 3 रुपए लग जाते हैं, उसमें काम हो जाता। और आज जो स्थिति है वो ये है, टेलीफोन का कनेक्शन का ही आपने 10-12 हजार साल का दिया, और उसके बाद में फोन उस पे एक भी नहीं आता, केवल नेट कनेक्शन के लिए आप लेके रख लो या फिर मोबाइल में रख दो। तो ये आज के जमाने में तो कई बार अपव्यय भी है। और मोबाइल होने के कारण से सारी सुविधाएं उसमें आ गई, नेट वगैरह की। और उसके बाद में टेलीफोन, पहले नंबर उंगली से दबाने वाले थे, उसके बाद में बटन आ गए, उसके बाद में सीधा आप बोल दोगे नंबर तो भी उसमें चले जाएंगे, या क्लिक कर दो। तो आज तो काफी सुविधाएं हैं, और टेलीफोन को भुलाते जा रहे हैं लोग बाग। जैसे वासु जी ने बोला, तो वो ये आजकल आपस में परस्पर जो ग्रुप बना करके बात कर लेना, उतना ही रह गया। और रिकॉर्डिंग में कुछ भी नहीं रहता, चिट्ठी है वो रिकॉर्ड है। और आज भी ईस्ट इंडिया कंपनी के पोस्ट कार्ड जो है उस समय चलते थे, या स्टेट के पोस्ट कार्ड होते थे, तो वो कलेक्शन में है। धन्यवाद सर। पवन जी नमस्कार।
जय हो, पुराने किस्से याद आ गए। बिल्कुल ठीक बोले आप। एक फोन था, घर का जंजाल था। जिसके घर में होता था उसकी प्राइवेसी चली जाती थी, और बाहर वाले घुसने के लिए संकोच करते थे। दोनों ही बातें बिल्कुल सच कही आप। आदरणीय डॉक्टर सीपी शर्मा सर यदि फ्री हैं तो कंक्लूडिंग रिमार्क्स फोन के ऊपर, उनकी भी यादें ग्वालियर की। आदरणीय डॉक्टर सीपी शर्मा सर हैं क्या? मेरे ख्याल से वो कंफर्टेबल नहीं है। गुड नाइट टू ऑल। टेलीफोन की यादों के साथ कल गुरुदेव एक वो है विशेष। कल सेंट्रल रिसर्च इंस्टीट्यूट में हमने सेमिनार रखी है। 3 सेमिनार है, 2 बजे से 6 बजे तक दोपहर में होंगी। कम से कम और नहीं तो 25 एक्सपर्ट्स, सीनियर एक्सपर्ट्स आशीर्वाद देंगे। 100 डॉक्टर रहेंगे। और सेंट्रल आयुर्वेद रिसर्च इंस्टीट्यूट, विश्व आयुर्वेद परिषद वेस्ट बंगाल और आरोग्य भारतीय अनुसंधान केंद्र के संयुक्त तत्वावधान में हम ये करने जा रहे हैं, आपका आशीर्वाद चाहते हैं। बहुत बहुत आशीर्वाद गुरुदेव, बहुत बहुत आशीर्वाद। थैंक यू। आपके आशीर्वाद की हमें हमेशा जरूरत है। गुड नाइट, गुड नाइट टू ऑल।